All right, looks like I'm live. Let me just confirm few more setup. Got it. That's good to go. Uh, yep, I'm live everywhere I should be. All right. Hey everybody, welcome back to our weekly live, and here I am. People who is the first time, my name is Alpesh Patel, and I'm a licensed physical therapist. I'm working since last 15 years, I believe so. Oh yeah, I just want to make sure my mic is on. But yeah, so I'm in this field for 15 years. I'm seeing all kind of patients from 4-month old to almost like almost 101-year old, I believe. So I've seen that. I'm here weekly talking to you guys one on one. I would like to answer all your questions, help you any way I can with your pain, with your joint pain, muscles pain, anything, pain related issues you have it. Here I am and ready to discuss with you. I do prepare some of the topics which can help you to educate you, help you to understand more about the pain, more about your conditions, lifestyle, etc. More or less about your healthy living lifestyle. And my goal is to make 100 million people pain free. So here I am, and trying to serve that goal and trying my best to help as many as people I can. So we have a long way to go. We just started last year. I'm sure we help few people, few hundred people for sure. So yeah, you can see we have a long way to reach to 100 million goal. But we'll get there. I'm confident about that. So yeah, for now, today, my purpose is even I can change one life with my knowledge, which I'm going to share with you guys. It may help you to live better. It may solve some of your problem. I'm happy to do that, and that's why I'm here. So let's start with that. Let's start with the updates first. As usual, we usually start with the update. So yes, a lot of you received my newsletter, and we're getting so much love about that. People keep replying and message me, DM me about how good information was, and they really loved it. So thank you everybody who messaged me, and I'm glad that it helped you. Now, people who are new, I just started a newsletter, has absolutely free. Like I said, my goal is to reach out to 100 million people and help them. So yes, it's absolutely free. It's strictly about information which can change your life, especially if you have a pain, if you have any muscular issues, any health related issues. And I pick a topic which usually I get a lot of questions during my practice, and I try to summarize them, and I feel like, you know what, these are the particular topic which I should be spread the awareness. So I'm sure there are so many people. Sometimes you don't even have the questions, but you want answers. So yeah, my job is to make sure that you get as much as information. So yes, last week, I think Saturday. By the way, newsletter name is Weekend. It's like a Weekend Warrior, and let me just confirm. And yeah, so yeah, people love it. It's a wellness weekend because the pain doesn't know it is weekend. So I gave this name, and it's all about pain, joint, lifestyle, posture. You can name it. I mix and match with the topic. So yeah, but the reason today's topic also is the same, because I want to make sure the when I distributed that newsletter, and a lot of people loved it, of course, but I also felt a lot of people have a lot of questions after reading the article, because and I thought about, you know what, why don't I involve the same topic today's weekly live, and we're going to discuss about it, because a lot of people have questions about, like, hey, I have my knee pain hurts, and so it's strictly knee pain, right? But I'm telling you, when we see a patient and when they come to the clinic and they say, oh, my knee hurts, oh, my shoulder hurts, and I can tell you, like, mostly 9 out of 10 times, it's actually starting somewhere else. So yes, you can treat your knee, but then again, you're just creating a I mean, you're treating just the symptoms, right? But you're not taking care of the cause. So yes, that's why that's the main reason. You may feel good for a day or two or three, or sometime in a week after doing, like, physical therapy, after taking care of self, taking some rest. Yes, you feel like, okay, pain is getting better, I'm good to go. But then pain comes back, and the main reason behind is that because that's not the cause, that's a symptom. So when knee hurts, uh, knee is a symptoms, but the pain, it could be your hip, it could be your ankle, it could be anything. And we'll go over with some examples, like why you have these kind of issues and how we can solve this in real life. So yes, so today's live is all about information, spreading the awareness about why pain in one joint actually is not one joint. It could be the multiple joint involved, and that's the reason you're not getting better, because you just trying to fix a one problem which is more temporarily, and we have to take care of the cause which creating more issues. So yeah, that's what we're going to discuss about it. That's update wise. And about the pain cream, yes, wait, I don't have pain cream now, but the pain cream, I started testing it. I started tested actually last week. I went to gym and I hurt my like a shoulder, probably I pulled my muscles, and I used it. I had to use a couple of times. Of course, I liked it. Like I told you guys last week, it was not the best cream I wanted it. So it's still not done. I'm going to do a couple of more revision before I finalize it. But I did try with I think like a 4 patient, of course with their consent, and I told them, like, this is more trial based, and it's, like I say, 100% organic. And so far, so I'm happy that all the patients loved it. In fact, they just wanted to buy it, but I told them no, because I was still not happy with the current formulations, and we need to do a little bit changes. So we'll keep you posted on that part. But it's a long way before even we do anything. So I have a lot of changes I want to make it. So we'll let you know about that part. So with saying that, let me just see if anybody has any comment, questions so far. Looks like pretty good from here. I'm sorry guys, I have multiple screens, so I'm just watching all over the place. So don't think like I'm not focusing on you or particular here. I have different screen and I'm trying to pay attention to every screen, so feel like more personalized. So all right, let me see. I want to make sure. Yep, pretty good. No questions so far. Amazing, amazing, amazing. Okay. All right, so let's start with our current topic. Now, today's topic, like usual, we discuss about it, like, wait a minute. What happened? Oh, okay. There you go. Give me 1 second, guys. I think somebody complained they cannot hear me. So I want to make sure you guys can hear me. Okay, is it okay? Give me thumbs up if you can hear me. Okay, so far so good. Let's see. Okay, all right, so looks good. All right, so perfect. So I'm glad that you guys can hear me now. And then we're going to discuss about some of the topic what we discussed. Now give me 1 second. Just want to make sure screen is good. All right, perfect. So yeah, the topic, as we said about, it's all about why pain start with one joint but you feel the other way. I mean, my bad. Why you have, let's say, a pain in the knee, but then actually your hip or ankle might be the reason, and what could cause that, or how we can solve that problem, or how even you find out, first of all, right? Because like I say, there's so many problems going on, and then how would you even diagnose this? And that's where it's become more complicated when it comes to the patient. So a lot of time we get a patients, mostly when they come, they're so like stuck to it. Like I have a patient recently, it's like, oh, my shoulder hurts. I'm like, okay, let me check on your shoulder. And I promise you guys, it was not actually a shoulder joint problem. It actually was more like a thoracic spine problem. So your upper back, oh, wait a minute, here you go. So there you go. Like you see, you have upper back. So when you have upper back issues right here, like you have a spine or even the neck issues, right? What happened is your body is trying to protect you, so they're going to do compensate. So that person particular, now I'm not telling you every person is same or every person has the similar issues, but most of the time this is what happened when you have a neck pain or something like that. Actually you're trying to compensate with the shoulder muscles, like your trapezius muscles right here, your deltoids, all these muscles like a rhomboids, everything. It works so hard that sometimes, like imagine, like if you do one time okay, two time okay, but like a years and years, if you do that, there is a time when your shoulder joint gonna give up, because it's called like a compensation or overload. So you're putting a lot of pressure on your shoulder joint, and now when you do that, that's where the pain starts on the shoulder. But now guess what, you can fix your shoulder joint, like you can try to do exercise, you can try to massage it, you can take the pain injection, anything you do, yes, you're fixing your shoulder joint, but guess what, you didn't even touch the neck issues. Now if you don't touch your neck issues, what's going to happen is after a while your shoulder pain will start back, I mean it will come back. The only reason is that because he will never fix the cause, which was the neck pain. And this actually happened in my clinic because we were targeting a wrong joint, and then patient continue complaining about the, hey, pain is not getting better, so what should I do? And we kind of evaluated and we realized that it actually the neck stiffness, like a spinal stenosis, that was the causing. And then once we started taking care of the neck pain, in like 2 weeks patients saw drastic difference, like there was no more tingling sensation, there were no more tightness around the shoulder. In fact, range of motion become so much better, like patient hardly could move her shoulder, but now the range of motion went like it's through the roof, like really the patient was able to reach the cabinet and all this stuff. Now I'm telling you again, we continued shoulder treatment, it didn't work. And that also is not that we already informed patient that that could be the another reason, but patient kept saying that no, I have no pain in my neck, so my neck pain is fine, I have nothing to worry about, just fix my shoulder. And despite telling the patient that pain is coming from the neck, because of the neck issues, she's having a shoulder pain. But again, thank God she listened to us, and then it worked out pretty good. So that's the main thing. Now why it happened actually, so what is the main reason, like we talked about it, okay, so neck pain happened and everything. I want you to think about like a chain. Think about like our body is like a chain, like your foot, your knee, your spine, your shoulder, everything is connected, right? So if one link, so think about the chain, if one link get weaker, or it just like overwork or anything issues with that chain, the counter effect will be felt throughout the chain link, right? So let's say for example, like your ankle is stiff, after the old sprain. So let's say you maybe twist your ankle when you were a kid or something like that, and you took care of it, but you didn't took care of it 100%. And when you get older, you start feeling that like a stiffness around the ankle. So what happens is when you have that stiffness, but you never worried about it because you're still able to walk, you're still able to go to your work, you're still able to play sports and everything. You never fix the root cause. And now because of the ankle stiffness, again pressure goes on to your knee, because when you try to put your foot down like in a flat feet and you're walking, the stiffness is not good enough. I mean, stiffness is crazy. So what happens is your knee has to compensate for to able to move forward, right? Like your foot needs to go up, and if you look at it, it goes like a little bit like the ankle deviations we call it, like so when you put the foot flat down, it moves a little bit side. And now if there's a stiffness, your knee and your spine has to do all the work, and that's why sometimes you get the knee pain. Now imagine it's not the one day, we're talking about the years and years of the bad habits, right? So whenever you get the pain, think about it like, okay, why it's happening? Is it like the strictly that knee? Now again, if you broke the ligament, let's say we're talking about the knee, not just saying the knee pain only, I'm just giving example of the knee because that's more common at this point. But let's say you have a knee pain and you were playing a sports and you broke your ligament, there's a meniscal tear or something. Now that's considered a localized pain, right? So then you don't have to worry about your hip, you don't have to worry about your ankle at that point, because you particularly broke one of the ligaments. So then it's become more localized issue. But then you have just like a general knee pain. I want you to always think about a both next joint, so that consider as a hip joint and ankle joint, and ask yourself a questions. Did I ever had an injury of the ankle or the hip? Did I ever had a problem? Did I not able to move better? Do I have any injury which I need to worried about, or anything like that? What is your work style looks like? Are your hip are pretty much in a flexible position? Are you moving your hip better? So these are the stuff you want to ask your questions, and then that's the reason when you patient come for the knee pain and we give the stretching for the hamstring, stretching for the hip joint, stretching for the ankle joint, and they were like, why are we doing everything? Because like I said, it's everything is chain, it's all connected with each other, and then you have to not just target one joint, you have to target the entire chain. Now of course, I'm not going to tell you if you have ankle pain, I want you to like stretch your shoulder or something like that. I mean, stretching always helps, but then you have to, that's why I said look at the proximal joint. So if it's the knee, what is the next joints? Next is, if you go down it's an ankle, if you go up it's a hip. So always target around that joints, right? So that's the main thing. So your pain show ups in one spot, right, and then started somewhere else. Like always the case. Even though you feel at that particular moment that no, something is not wrong, I only have a knee pain, but have your therapist or your doctors check it out, all of the joints, not just one joints, and let them help you to figure it out. So now we just talked about the knee pain. Let's talk about the elbow pain or the wrist pain. I'm gonna give some examples, right? So that will help you to understand the joint wise. Now, let's say you have a elbow pain or the wrist pain, right? Now I don't know if you know, but I already have a Theravio kit, which about the hand and wrist pain, right? And there are certain and if you, it comes with the, I'm sorry, it comes with the book, which also free, absolutely free. You can go to my website theravio.com, you can download free, you don't have to buy my kit, nothing like that. You still get the kit for book for free. If you buy a kit, of course the book is automatically involved, has a link and everything, but just in case, to let you know. But now the reason I'm saying that, if you get the book, it has a 4 week of stretching plan, and a lot of time the stretching involved like this kind of a stretching. Now you're not just stretching your wrist, you're stretching the whole forearm and everything, right? So there are certain stretching exercises I gave that includes the multiple joints. Now why I'm telling you this thing, because when you said I have a knee, I'm sorry, my elbow hurts or wrist pain, now a lot of time it can be because of the shoulder weakness. So when you're trying to lift something or you're trying to hold something, now if your body is not strong enough, your shoulders muscles are not strong enough, what's going to happen is when you try to lift it or when you try to hold something on your hand muscles and your elbow muscles has to work so hard in order to make sure the grip is tight and you don't lose, you don't like drop that things, right? Like drop that particular thing. So because your hands and elbows working so hard to compensate for the shoulder weakness. Now let me give you an example. Think about, you have, I'm sure, let's say you are working at your job, and then you have 4 people working. Imagine, just like, I'll give you an example, right? Now 2 people in the morning call out sick. Okay, no problem. What's gonna happen? And now those 2 people who are working, which is you and your friend, are going to work extra hard, because now you just don't have work for 2 people. Now you have to do work for the 4 people. Now, okay, one day you are okay. Yes, I can do work, no problem. It's absolutely okay. The second day, same problem. Third day, how long, guys, you can continue working by yourself without asking for help? Not too long. Why? Because you will give up, your body will get tired and you feel like this is not right. That's the same thing going on with our body. When one joint gets weaker or you don't give the attention it require, what happen is, because it's a weakness, going to put the pressure on other part of the body, which is other joints, other muscles, other ligaments. And then yes, for few days, few months, few years, that's okay to put the pressure, because your body is designed to adapt. But not too long, guys, not too long. Your body will give up, like you do at your work after other people don't show up and you have to do all the work. So your body will also give up and start sounding this alarm, like kind of by giving you pain. So don't consider pain is like panicking more. It's more about like kind of a warning to you guys. So when you get like a nagging pain or a little bit pain, that's more like kind of a warning to you guys, saying that, hey, you know what, right now, before it get worse, this is the time to fix it. And that's the best time to fix it, because you can definitely isolate the proximal and the distal joints, uh, or next joint to like up and down joints, based on that, the joint you have a pain, and then you can take care of it right away and can help you to solve your issues. But this is really really important to understand that part. So you like, because you need to understand your brain jobs actually to protect you, not to hurt you. So whenever you get any pain, that's more like a warning sign. Just because your body doesn't want, I mean your brain doesn't want you to move and break something, like that you get bedridden, right? So when you have a ligament pain, when you have arthritis, when you have like any chronic conditions, like, and when you're going through a lot of pain, that's mainly, that's mainly because you are hurting yourself. Your brain is trying to protect you and just giving you like kind of a pain to say, hey, that's it, don't move, because if you move, something worse gonna happen. And that's like, your brain going into the panicking mode, right, instead of you. So it's always like kind of a like a how do I explain, like a warning sign your brain gives it, right? So you have to kind of understand the brain signals when they give it to you, and listen to your brain. Don't avoid it, don't ignore it. It's much needed, because you feel like, I'm good and I don't need to do anything. And yeah, you do feel like, 2 days you take rest, don't do nothing, take pop a pill or something like that, and you start feeling better, and then go back to your routine. But you did not fix the cause of the pain, and that's where the pain gonna keep coming back. So you may feel like better in 2 days, fourth day pain will come back again. You do the same thing, you will feel better. 10th day pain will come back, and it will keep coming out. Every time pain come back, now your brain, last time the here's the funny, your brain tried to give you a warning, guys, by giving you a little bit pain. What did you do? You ignore it, you pop a pill or something like that. Now when next time it happens, you experience pain comes with like a very intense, the pain even get like, if pain even get worse. So next time, let's say you first time your pain, let's go by the number, like the pain you had like a 4 out of 10. 10 is like you have to go hospital, right? That crazy pain. Let's say you had a 4 out of 10, which you can do your usual work, it's bother you, whatever. Now again, you pop a pill, you took a rest, you put some ice pack, you put some cream, and 2 days after, pain went, and you back to work, you back doing what you need to do. Guess what's gonna happen? Whenever pain, it may take a few days or few weeks or few months, but whenever pain comes back, it won't be 4 out of 10. You know that. The pain will be between 5 to 6 out of 10. Again, you do the same thing, you pop a pill, you do whatever you need to do, heat pack, ice pack, cream, massage, or whatever makes you better. Now, the minute you do that, what's gonna happen? Pains come back. Whenever it come back, guess what? It's a 7 out of 8. I mean 7 or 8 out of 10. Then you start getting panicky, and you right away kind of push yourself like, oh, I need to fix this, I need to figure it out, I need to do some other work. But it's too late already, because you're already 7 8. Now you need like a little bit more longer therapy, and that's why your therapy takes longer, your recovery also gets longer. So I want you to more like kind of think about it as like, whenever pain is like below 5, that's the best time to fix it. And not just that joint or that's a problem, we have to find the cause. So whenever next time you go to a therapist, you go to a doctor, you can ask them a questions. What about my other joint? Do you think I have any issues with that? Because like I say, let them check your gait. I'll give you another example, like a hip joint, right? Like say there is a hip weakness. I can guarantee you a lot of my patient has a back pain. The problem they're having is with the hip rather than the back. Now, yes, you're right. You might have a spinal stenosis. You might get like any spinal condition like a disc bulging. These are the word you heard about it, and which are absolutely right. You might get it, but you don't know how you got there. That you reach that far, that you got a spinal stenosis, spinal spondylolisthesis, all this spinal condition like a disc bulge, herniated disc, all these conditions happen because you didn't take care of yourself. And that happened mainly, now remember, if it's the lower back, the upper goes the upper back, or like a thoracic spine, like, oh, let me show you that. Here you go. Uh, you can see it. Yep, there you go. So if it's a lower back right here, right? So you feel like I have a lower back pain, but a lot of time, think about the thoracic spine, your neck alignment, or your hip joint. Like we talked about it, we're going to talk about the proximal joint, like whatever the next joint comes to it, and then other joint. Now again, each spinal vertebra is very much important for this point, but we're talking like a general concept. Now, couple of things can happen when you have a back pain. That happen because you don't have enough mobility in your hip joint. So when you move around, you feel like, oh, I can I can lift my knee, I can kick somebody, no worries. But did you try stretching your hamstring? I can guarantee you, every patient come to my clinic, when I stretch the hamstring, they really scream hard, just because that's so freaking tight, right? So that's the cause is, I'm telling you, you feel like you're doing good, but no, your hip mobility is very limited. Now every time you walk, you jog, you run, or you do any twisting movement which require the hip movement, technically it's not your hip moving, because your hip is only it's so tight, or it lost is the mobility, that it only function like 70 or 80%, right? So next 30% coming from your back muscles, because the back around this area is compensating every time. So it's doing the trunk rotations when you're trying to kick somebody, rather than just a hip movement, right? What happens is, because of that, like we discussed earlier, if it's a one time, two time, but imagine years and years and years, and if you keep doing that, your spine gonna give up, and that's where the problem happens, and that's where the pain start. And because years and years is happening, it affect now the particular spine issue. So you will get the herniated disc, you'll get the spinal stenosis, or any disc bulging, all those stuff, you can get it. Now you understand, at that time, if you had like the herniated disc, yes, it's good to treat your back pain because you have particular issues there, but don't forget to treat the other joint, right? So you have to still work on your hip mobility. And a lot of time, my back exercise videos, if you see, it require I always advise to do a lot of hip exercises. So all the back exercise involves the hip mobility activity, and you will feel really amazing. I think I'm going to shoot some of the more like back pain videos, and we'll share it with you guys when it's ready, but I'm just letting you know. So yeah, like we discussed about it, right? So I want you to look above and below of the joints wherever you have a pain. Then you have to train the movement, not just the muscles, right? So think about the movement. Any movement is from 0 to 100, right? Try to do the full range. If you do like 70, 80, now you telling your brain, this is the only I can move. So you moving your hip, you moving your shoulder. Look at this. This goes up here all the time. I'm just giving you an example. There's like 100, right? Like, oh, I'm sorry. There's like all the way up. Giving you example. But if you keep doing only here, what happens is your brain register, your joint register, this is my motion. That's why. Now, if you continue doing for years and years, and your joint only go this far, never here, what happened? Your brain kind of decided that this is my normal range of motions, and your shoulder also decided to follow what your brain says, that this is what I can do. Now, think about, you have to go higher. What's gonna happen is, because you cannot go up, so what you're gonna do? It's trying to loop. You see that what I'm doing it? You're trying to sway your body in order to reach that high. Now, you see I can go higher, but if I go back to neutral, my shoulder is only still there. It didn't go here. It's here only, right? So based on that, what I'm trying to explain here is that use your 100% range of motion. Do not settle down with like 70-80%. So when you can, and that's the reason when you do stretching, they want you to do the 100% range of motion. Try to do the best you can, and also keep pushing yourself, right? So that's the main reasons you want to do it. And what's your daily habits? That's most important. I don't know if you took my posture course, but if you did it, we talked about daily habits a lot. How you sit, how you stand. One thing, don't try to change a lot. I know how many times I'm going to talk to this, but I have spoken this thousands times, and I'm telling you again, it's all about one thing a day. If you try to fix everything, never gonna happen. You're gonna get tired. It's like losing a weight, everybody knows that. Or going to gym, you go to gym because you're very excited, you want to really get rid of that weight. You start dieting and everything, and everybody know it's so hard to do maintenance, and then after a while you give up, or maybe you fall out of your routine, and it's so hard to go back, right? That's because you set yourself so much, like, I would say, like a hard life, that your body or your mind is afraid to go back to that, right? So don't try to, when it comes to the pain, when it comes to your mobility, when it comes to changing the lifestyle, do not try to change everything. That's where you're giving kind of a shock to your body. I want you to think about like a one thing you can change. Let's say today I'm standing straight, right? What I would be able to do. So instead of standing straight like that, I'm going to lean to one leg and then also another leg, right? What I can do is that will lower the pressure on my spine. If I stand straight, they will put pressure on my spines. But if the minute I shift the weight, now I'm distributing a pressure between each leg, and that will put the less pressure on my spine, right? So that's kind of a thing. One thing, I don't have to raise the desk, this. Your body is going to get shocked, and now your body needs another adjustment. Your brain need another adjustment to learn this new way, and learning something new, it's hard. And then if you give up, your brain doesn't want to do that extra work, and you go back to the comfortable position, which was nothing, right? So that's the reason I'm telling you, like, change the one thing. Either just reminding yourself to stand straight, either just drinking a 2 glass of water, either just like kind of a take like 10 minutes walk, or even like a 2 minutes walk. Do that something, but do one thing. Don't try to do everything. Now once you get a habit, once you get a routine of that, then you try to add another layer to it, and I promise you that thing at long lasting, your brain, your body, everything will thank you for sure, of course. Okay. All right. So I think I cover most of the thing I had to. We already discussed a lot of other things. I see some of the people on the Facebook. Maitreya says, "Thank you, great information." Thank you, Maitreya, for supporting. By the way, Maitreya is also amazing physical therapist, so it's coming from him means it's definitely I did my part. So I got thumbs up from another physical therapist, means he approved my information, so that shows that I'm not lying or at least I know what I'm talking about, right? So yep, that's all about it. Anything else, anybody has any questions, feel free to ask me. I'm here for a few more minutes. People who join me later on, remember, I do this every week, Monday at 7 p.m. EST. I'm going to start a YouTube channel. I'm going to share some of the videos. Feel free to go there. All this information are absolutely free. Now, I do have a Facebook group. It's a private group. Again, I do everything. It's free. Trust me, guys. I do not charge for my information. I do not charge for consultation. And if ever I charge, it may be because people don't respect the free values. But usually, I'm against it. And so yeah, these are all information. It's absolutely free. You can join my Facebook group, and during the week, if you have any questions, feel free to ask there. You can ask me anything related pain. If any of you guys have a serious issue and they really want to and if you really want to kind of need my advice on it, you can DM me or personally reach out to me, and I can schedule a Zoom call with you guys, if anybody need it, and let me understand more about your conditions or your pain point, and then I'll do my best to help you guys. And yes, absolutely free, so don't worry about it. I'm not gonna charge you for that. Now, of course, I cannot fit everybody on my schedule because I'm currently working. So it's not like I'm telling you I'm just making a videos and I'm just doing this social media. No, I'm actively seeing the patient in the clinic. So whatever knowledge I'm sharing or whatever the information I'm sharing based on my current practices. So but also it comes with the limitations, right? Because I have a business to run, I have a family and everybody. So what I do is, like, I try my best to come to the live ask you any questions you have. You can join my Facebook group, ask me any questions there. And then if you really need to go on live, if we cannot solve the problem through these two medium, then yes, feel free to reach out to me and I'll schedule a Zoom call and then we'll do help. But again, like I said, it based on the availability I have, but I'll do my best. I'm here to help, and as long as you're ready to change it, I'm gonna help you as well. But yeah, otherwise, that's it, guys. So I hope this information helped you, and hopefully this will make a little bit change in your life. Like today, one thing. So now I want to ask you one thing. Like, what did you learn from today's, right? Like, if you have to summarize, what would you say that okay, this is the information was amazing? Yes, definitely you agree with that, but the question is, did you learn anything from here? I don't want you to just take this information, go eat your dinner and then go to bed. No, it doesn't work like that. I want you to ask yourself a question like, okay, what did you learn today that can help you to change your one habit, or help you to find the where the problem is, find the where the pain is, and how you can solve that. So that's what it is. Just ask yourself, think about, pain is a clue, it's not your enemy. So think about like a pain is kind of a helping guide. So when it happens pain, instead of like start getting panicky and run around, I want you to guys ask some questions to yourself. Why pain happened? What did you do? Did you assess like I said, the proximal joint and the distal joint? What else could be involved, right? Is it the stress? I think last week we discussed about the stress. So is it the stress? There's so many factors involved there, and the more you understand all these issues, you can actually help yourself before even doctors or other physical therapists, occupation therapy, they help you. So this is very much important to understand some of the basics when it comes to the pain, and that will improve your recovery time by drastically. I'm telling you, some people take like 6 months, it would take a 1 month to get better. You know why? Because now you understand the basics. Now you understand where the pain starts, you understand what you should do, what activity is related, like everything. So just use this information as understanding, and just find a one thing you can change today to change your life. It could be the one stretching you can do every day, it could be one exercise you can do every day. You can just like position yourself, or just the one daily reminder you can put for yourself. Just do one thing which you learned today, and I want you to do that, and hopefully that will help you. All right, okay, it was great fun as usual. I'm loving it. I don't know, I'm loving this thing, YouTube live, straight to talk. Videos, yes, I make it here and there, but I love it, this thing, because there's no preparation, nothing. I can speak to my heart to you, whatever comes in my mind, whatever comes to my heart, I just spread the awareness, give the information, and give you the knowledge you need. Okay, all right, guys, thank you everybody. It was great talking to you, and I'll see you next week. Hope it helped you. Take care. Bye.